Hey there, I'm Julie Hirschberg. I am the owner at Re+active Physical Therapy, and I'm standing outside at the beautiful UCLA campus on this wonderful evening. I'm running a little late. We were scheduled to do this at 5, and the HDSA Hope and Cope conference in Los Angeles just ended. We went a little bit late because there was really great discussion and good questions about access to care. So I said I'd hop on here with a quick update, and I'll make it quick so I can head on home to my family today. But the Hope and Cope conference is something that the HDSA and the HDSA Center of Excellence at UCLA puts on every 2 years to give an update on the latest research in Huntington's disease. And there are some really cool things that are happening right now. So they had a bunch of really great speakers, and I got to speak on exercise, of course, and our current research trial. So let me just give you a quick rundown. There was a nice update from the group at Roche and Genentech. They are doing a brand new drug trial in Huntington's that's an intrathecal drug that has been shown to decrease the HTT protein, which is really important in Huntington's. So this is a really exciting trial, and it is just starting in 15 different countries. So one of the things that they emphasized throughout the day was to use HD Clinical Trial Finder to sign up and get updates on these different diagnoses. And sorry, it's a little breezy right here. So she gave an update on that. Also, there's a great nonprofit group called CHDI that does really a lot of collaborations on the drug research in Huntington's, and they're non-profit, so they're not a biotech company, but they facilitate a lot of this research. And their mission is to rapidly develop therapeutics that slow the progression of Huntington's. And they have some exciting preclinical trials on small molecules. So right now, some of the current research is looking at things that are done via lumbar puncture, which is pretty invasive, and not a lot of people want to do that. So they're looking at small molecules that can be done with via an oral medication. So there's some preclinical trials on that. And one of the biggest things is that they have found a CSF marker for the HTT. So essentially, they have a really nice outcome measure to show efficacy. So I think that was a really exciting piece of their current findings. The next person that talked today talked a lot about cognition, and this is one of the biggest things that we see in Huntington's that can be so challenging for everybody, for the family, for the patient, for their ability to exercise and do physical therapy. And this person was from Sage Therapeutics, and they have a clinical trial for what he called a neurosteroid type of drug to help the cognitive symptoms in Huntington's disease. So also very, very cool. Like, this is like breaking clinical trial stuff for Huntington's disease. I was the next person to talk, so it was kind of fun to go from really super heavy scientific clinical stuff to the exercise and the exercise study that we're doing. So if you didn't know about it, it's called PACE HD, and we are literally recruiting for just a couple more weeks, just until the end of April. And we're recruiting people with Huntington's to be a part of a randomized controlled trial. This is something that we are a site for with UCLA, which is pretty exciting. And we are doing an exercise and an exercise coaching intervention over the course of a year for people with Huntington's. It's been a really great experience for us to be a part of this clinical trial. And so basically, I had some time to talk and get a few more people signed up to potentially be recruited into the study, which is exciting. And just to talk about exercise, and what was so neat, we love collaborating with UCLA. One of their movement disorder neurologist, Yvette Bordelon, was there, and she also talked about the current state of clinical research and practice in Huntington's. And I would say, I might be biased, but she spent the majority of the time talking about exercise and the importance of it for how you feel, but also for what it does in the brain. And she talked about the neurotrophic factors and helping to make those brain changes. So that was pretty fun. So we had a lot of people asking questions about exercise, asking about the clinical trial, asking about physical therapy. One of the reasons it ran over late was we were talking about advocacy and people getting really frustrated that their insurance might pay for a couple visits of therapy. And when you have a degenerative disease, you need much more than that, and you need it over the course of your lifetime. So we talked about advocacy with insurance companies. We talked about skilled maintenance therapy, something that's really important for us as physical therapists to understand and be able to determine if somebody needs skilled maintenance therapy and how to justify that for Medicare and maybe even other insurances. So this was a really engaged audience of caregivers, people with Huntington's, just a lot of people to give input to us as healthcare providers about what their needs are in Huntington's. And I thought that was really powerful. So one last piece that they talked about too when they talked about advocacy was our ability to talk to our local government, our local senators, talk about things like the HD Parity Act, which is something that we've been trying to push in Congress so that people don't get kicked out of their insurance and things like that. So a lot of great ways to get involved, and the HDSA.org has so many fabulous resources. So go to HDSA.org, check it out, and get resources for people with HD, really good resources for people, healthcare providers. So I mentioned this just this last week. We did our learning module on Huntington's disease. It's part of our Schmidt movement disorders fellowship that we have, and we did the learning module on Huntington's, and I recommended a bunch of resources from the HDSA. And I'll put some links in here on our Facebook page as well, because I think they're helpful for anybody working with somebody with Huntington's disease. And part of our fellowship is why I was here at UCLA today. We, in the Schmidt Movement Disorders Fellowship, we collaborate with UCLA, and it was really fun today to see the movement disorder neurologists, talk to the other movement disorder fellows, the MDs that were here, and have them talk about how great it is to see what neurologic PT is and what it can do for their patients. And they were just so excited that we have been a part of their clinic. So in the Schmidt Movement Disorders Fellowship, we get to be in the movement disorder neurology clinic and observe, help answer questions, really act as a teaching faculty in the system. And it's been just a wonderful experience for us as physical therapists, but also for the neurologist. So that wraps it up. I know I talked really fast because we're running a little bit late. Thanks so much for joining me today. We will kick off with a couple other Facebook Lives next month, and a big one on stroke, because if you're interested, if you're a physical therapist, there's a great course coming up at the end of this month. The CPTA puts out a great research update, and it's on stroke, and we have Carolee Winstein, Dorian Rose, Nancy Beal, amongst other really great stroke experts talking at this course. And so I'm doing a small part of that course, and so I'll do a Facebook Live to give you an update as well. And check us out at reactivept.com. If you're a physical therapist, our education page is up there, and we put a lot of great resources. So thanks so much, and have a great rest of your Sunday.